I'm verifying the delivery sheet with the delivery ticket on here, so just to make sure it's not going to the wrong facility. Prior to working here, I had no idea what all was involved in the process. It's pretty amazing. You know, we're kind of behind the scenes, but we're somewhat saving a life on occasion. You know, I know a lot of it's just for routine surgeries and things, but car wrecks and shootings and those kinds of things create emergency needs. This is what's considered a shelf run, and we're replacing blood that they've used through the night or since our last time over. So depending on how busy they were previously, the shelf can come and grow. But you know, this is about typical. But we do stat deliveries based on patient needs, and that can run anywhere from, you know, in total we probably make 8 to 10 deliveries a day to UK.
Once we receive them, we do a number of quality and safety checks to ensure that the blood is safe, and then we will then put it into our general inventory so that anyone who needs any blood products can receive it. There are so many different patients who need blood. Blood is one of the most, if not the most common hospital procedure that's actually performed in a hospital. And so patients who may need blood may range from expecting mothers and neonates to children who may have solid organ cancers or cancers involving their bone marrow. We may have adults who come in as a trauma, and even patients who may be toward their end of life who are very critically ill and may need a compassionate transfusion just to help them feel better. Any and all of these people may need blood, and so the list is endless, but we're here to make sure that anyone who needs a transfusion can get a transfusion to help them in their care. When they call us to say the magic words, massive transfusion protocol, that basically is a clue to us that there is a patient who may need a large transfusion of blood. And everyone works as a team here to ensure that that patient who needs blood gets all the blood that they absolutely need to help them survive whatever it is that they're experiencing.
So Level 1 Trauma Center is really the highest designation that the American College of Surgeons will bestow on a trauma center. It's based on criteria that are required to provide the highest level of trauma care. For us, being the only Level 1 trauma center in the region means that we are the referral center for the most severely injured patients really in the state and the region. About every other day, someone comes into this emergency department who's badly injured, who needs blood immediately to correct whatever problem they have. If we don't have blood available, then those patients are unlikely to survive. Our outcomes here are quite good because of the donations that people in the community make to allow us to deliver blood products to injured patients here. If you have a very severely injured patient, so someone who has a bad car accident or a gunshot wound with major vascular injuries, they can use a lot of blood product to get them controlled. And unfortunately, if you use those products for not just trauma, but other areas of the healthcare system, you could use up to 100 units of blood, which we've done before in patients that have survived here. And without the donations from the community, without that robust resource for us to be able to use, if that's depleted, then the next patient doesn't have that same opportunity. Blood donation as a trauma surgeon, I can't overstate the importance. I cannot do the job here that I do without the donations from the community. And we get a lot of credit as a trauma program, but it takes really the whole community to come together to provide the resources to save these patients' lives.
Here at UK, we gave over 4,000 blood products last year to cancer patients alone, and that number continues to grow as our cancer patients, we see more of them every year. We give blood products to our patients daily. Some of our patients inpatient require them. Sometimes patients that are in the outpatient setting that are coming in for treatments, they also require blood transfusions. If your blood counts are low, sometimes that means that your body isn't in a state where getting the chemotherapy would be effective. Sometimes the treatments that we do cause your blood to be low. So you need the blood transfusions to sort of bump you back up so that you can continue on with treatment.
So as a pediatric intensive care physician, as well as taking care of cardiac patients, we have it on a frequent basis. And I often think we think about meds all the time, where we're going to get this medicine, but we often are just dependent because we know that's the backbone or foundation of what we do to allow us to take care of kids. Some of the most complicated kids, often born with single ventricles or different cardiac anatomy, those kids not having blood products is it's the difference between life and death in many different ways. So it's often used for patients from small babies all the way up, and it's not just for trauma, it's also used for leukemias, different types of cancers, different types of anemias. And we see that use as being critical, because obviously we think about blood products in many, many different ways, and we think about them in the most traumatic things, but a lot of times they're part of the daily regimen for a lot of these patients that have cancer.
Noah has a blood disease. It's called beta thalassemia major. And of all the thalassemias that are out there, this one is the worst one because it's transfusion dependent. But he's 102 transfusions to date. There's 102 people out there that have donated blood to help save his life. If he didn't have the blood, then he would not be here with us. So one thing we want to do is thank everybody for the donations, but also try to encourage others to donate. A lot of things that help me out is to try to put a face with who I'm helping out. And Noah's helped me with that. I can look at him and see how many donations or how many transfusions he has received and how many needle sticks he's received. And surely I can do that one. He gives me the courage and the strength.
People ask me all the time, how do we support the trauma program? And whether that's time or money, but the blood resource is really a tangible way to do that. And you can feel assured that the blood that you donate at their blood center is going to help patients here in Kentucky. And that to me is really the most important thing with the partnership we have with them, is we know exactly where those resources are going to go. And they're going to be to the good of the community and really our region that we care for.
Very honored that we are able to carefully handle and ensure that the blood that has been provided by amazingly altruistic and generous blood donors is handled with the utmost care and utmost respect, and ensure that it is going to the right patient at the right time, so that truly we're able to help facilitate saving lives.
I think for someone who's willing to donate the time and the blood cells, I don't think we often say thank you enough to those individuals, because they do make a difference in life. Sometimes they make a difference in the life of a child that is here, and sometimes it's even to an adult. So we're very grateful for those people willing to donate, not just the time, but donate a piece of them to be able to save other lives.